Hello everyone, this is Med School Moose, and this is USMLE Step 1 High Yield Images Part 9. I know it's been a while since I've made one of these videos. I think it's been about 8 months, which is pretty crazy. But between starting residency and also my new podcast, which, by the way, shameless plug, link is in the description. Please do check it out. But between all of those things, I haven't had as much time as I would like to make these videos, unfortunately. That being said, I know that medical students are starting to kick it into high gear for their board studying, so I wanted to make another one, and hopefully there will be more coming in the future. If this is the first time that you're finding my channel and these videos, welcome. I make this series of high-yield images. Basically, it's kind of set up like flashcards or like an Anki deck where I show you the picture, I let you think about it for a quick second, and then I give you the answer, whether it's the diagnosis or a trigger word or what have you. And then I also give a couple of important points to go ahead with that. And I've gotten some good feedback on it. That's why I've kept doing it. So I hope you enjoy. And without further ado, let's go ahead and get started. This first one is a pretty easy one. We're starting off easy here. This is an example of Acanthosis nigricans. And basically what this is it's epidermal hyperplasia leading to hyperpigmented and thickened skin. And you can see that here. Her skin is definitely, the patient's skin is definitely darker and thicker than the rest of the patient's skin. And it's commonly seen in the neck, as it is here, or in the axillary area. And the big association to make with this is insulin resistance, whether that be obesity, diabetes, metabolic syndrome, any of those. If you see Acanthosis nigricans on the neck or in the axilla, you want to be thinking about insulin resistance and those conditions. This next one is a little bit harder. It's an example of coronary artery aneurysms, and all the arrows are pointing to the aneurysmal dilations. Here's a really good one right here. And the big association to make with this is Kawasaki disease, which, just to trigger your memory, this is a medium vessel vasculitis. Some of the other symptoms associated with Kawasaki disease include fever, strawberry tongue, cervical adenopathy, and a hand and foot rash. Really, I don't think there are any other associations to make with a coronary artery aneurysm aside from Kawasaki disease, but that is the major complication, so it's definitely something to be aware of. This next picture is tougher. It's an example of a cardiac myxoma. So a tough picture and probably a little bit lower yield, but it is included in the first aid book, so I wanted to include it here as well. And you can see the arrow pointing to it right here. So this cardiac myxoma is the most common primary cardiac tumor, and the majority of them occur in the left atrium. And the important thing here is that it causes a ball valve obstruction, as well as positional cardiac symptoms. So if you can kind of imagine, as blood is passing from the left atrium into the left ventricle, kind of that force and that pressure can kind of suck the myxoma to occlude the mitral valve, and that can cause, backup of blood and the cardiac symptoms associated with it. So important to know, cardiac myxoma. This next one is a little bit more subtle. It is an example of gingival hyperpigmentation. As you can see right here, notice that the, more distal border of the gingiva is nice and pink, and then as you go more proximal, it's a little bit darker, brownish, reddish. The big association to make here is with primary adrenal insufficiency. And the reason that you get this hyperpigmentation is because of increased MSH, melanocyte-stimulating hormone. So if you think about it, the adrenal glands are not producing hormones, so the pituitary gland is going to secrete more ACTH to try and increase that adrenal gland production. And what happens is, as ACTH is being secreted, another hormone called palsy is being secreted, and MSH, melanocyte-stimulating hormone, is a byproduct off of that. So that also goes up, and that is why you're getting this hyperpigmentation. And another distinction that I want to make here is the difference between hyperpigmentation, which is obviously this darkening, and hyperplasia, which is the thickening of the gingiva. And if you can recall, I believe I've talked about it in the past, the big association to know there with gingival hyperplasia is the use of phenytoin. This next one, also a little bit subtle. This is an example of intussusception, and this is ultrasound. They typically don't show ultrasound scans on the USMLE as far as I know, but again, this is something that's mentioned in the first aid book, so I want to make sure that you're aware of what it is. So we're looking at this right here. It's an ultrasound of the bowel, and it's showing this kind of target sign, if you can imagine the circle within the circle here. And this intussusception is common at the iliocecal junction. Most commonly in kids, but can occur in adults as well. And one of the big symptoms that kids present with is current jelly stools. So if you see that target sign or you hear current jelly stools in the vignette, one of the things you definitely want to be thinking about is intussusception. This is another tough one. This is an example of histology of alpha-1 antitrypsin deficiency. And really what we're looking at here are these PAS positive globules. You see these reddish, pinkish globules over here, another big one right here. That's the histology of alpha-1 antitrypsin. And what's happening is these PAS positive globules occur in the liver because of misfolded proteins that aggregate in the liver cells in their endoplasmic reticulum. And the big other thing to remember with alpha-1 antitrypsin deficiency is the vignette. Classically, it's going to be a younger patient. They've never smoked or anything like that, and they have shortness of breath, and they have liver damage, and they may also have a family member, parent, or something that had this condition as well. So a tough picture here, but definitely something that's important to know for alpha-1 antitrypsin deficiency. This next one is an easy one. I decided to give you guys a break after a couple hard ones. This is just an example of jaundice. As you can see here, the yellowing, also known as scleral icterus, which may not even really be the correct term. It's more of a conjunctival icterus because that's where the yellowness is occurring. And this is due to increased bilirubin deposition. The causes for this, there is a mnemonic in the first aid book. It's called HOT liver, H-O-T liver, and the H is for hemolysis, the O is for obstruction, the T is for tumor, and then the liver is for liver disease. So important to know those 4 causes of jaundice and the presentation of conjunctival icterus. This next one is an example of an elliptocyte. So you can see it right here. You can see a couple of them. It's like an elliptic kind of jelly bean type shape. And this is due to a condition called hereditary elliptocytosis, which is really asymptomatic. It's caused by mutations in genes that code for the red blood cell membrane proteins, most commonly spectrin. But the red blood cells aren't defective to the point where it really interferes with their oxygen carrying capacity or anything like that. So patients with this, it's usually pretty benign. They don't really have too many serious symptoms. This next one is an example of Birbeck granules, and this is seen in Langerhans cell histiocytosis. This is a pretty classic, quick association you should be able to make. It's described as tennis rackets or rod-shaped. So if you see a picture like this, you definitely just want to make the association with Langerhans cell histiocytosis. This next one is an example of a Greenstick fracture, and you can see it especially on the lateral view of the left right here. Basically what this is it's an incomplete fracture extending only partially through the bone. So I wish I could zoom in and show you guys here, but you're just going to have to take my word for it. This fracture here does not go completely through the bone. It's only a partial fracture. Most commonly occurs in kids, and the reason that it gets its name is because the bone is bent like a green twig. So Greenstick fracture. Another easy one here. This is an example of Raynaud's phenomenon. And basically what's happening is there's decreased blood flow to the skin due to arteriolar vasospasm. And it's in response usually to cold, but it could be to stress. And what happens is at first the digits, the finger, whatever it is, turns white due to complete ischemia. Then it turns blue due to hypoxia, and then it turns red due to reperfusion. So if we're looking at it here, these 2 fingers are kind of in the ischemic stage, and then the rest of the hand, maybe a little bit blue down here for hypoxia, and then these fingers are red for reperfusion. This can be primary, which means it can be idiopathic, and we don't really know the cause, and it's pretty benign, or it can be secondary, and it can be associated with conditions like lupus or Crest syndrome. Remember that the R in Crest syndrome is Raynaud's phenomenon. This next one is an example of an Abducens nerve palsy. And remember, the Abducens nerve is cranial nerve 6. So if you remember that little mnemonic, SO4, LR6, AO3, The LR6 means that cranial nerve 6, the abducens nerve, controls the lateral rectus muscle. So what happens when you have a palsy of the abducens nerve is that the affected eye cannot look laterally. So we're looking here, patient's looking straight forward. The patient's able to look to the right, so laterally with the right eye with no problem. But then when he tries to look to the left eye cannot look laterally. And that's because of that palsy preventing the lateral rectus muscle from pulling the eye laterally. So the left eye is the affected eye. And the way that it's described in the first aid book is that the medial directed eye cannot abduct, so it cannot go away from midline, which I think is just a little bit confusing. It makes more sense to say that the affected eye cannot look laterally. The other important thing to know about this is that cranial nerve 6, the abducens nerve, is really the most commonly tested cranial nerve in terms of most likely to be damaged or to suffer ischemia due to its kind of long, winding course. So that's another important thing to know. This next one is an example of a pale infarct. So just in case you couldn't figure it out, what we're looking at here is a cross-section of a kidney, and this is the infarct right here, nice and pale. And the reason that it's called a pale infarct is because basically what happens is an organ with a single end arterial blood supply has a branch of that blood supply cut off, and the area becomes ischemic and anemic, and it turns pale. So it happens in the kidney, and other organs that it happens in include the heart and the spleen. So pale infarct due to an organ having only a single blood supply, and an area of that is cut off. This next one is an example of cheilosis, and basically what we have here is inflammation or scaling of the lips and fissure formation as well. This is most commonly occurring at the corners of the mouth, but it can affect the entire lips in more severe cases. And the big association to make with cheilosis is a vitamin B2 deficiency, a riboflavin deficiency, is where you'll commonly see this cheilosis. This next one is an example of bone metastases. So this picture here is probably not as high yield. This is more nuclear medicine, and I don't really think they show this as much, but it is something that's useful to see. And the important thing to note here is the distribution of the metastasis. Note that it's distributed in the axial skeleton, so really a lot of the spine and then the pelvis as well. And the important thing to know is the cancers that cause bone metastasis. So prostate cancer and breast cancer are the two big ones. You definitely need to know those because those cause it the most. Lung cancer can also do it. Thyroid cancer can also do it. And kidney cancer can also do it. But remember, the big two cancers that cause metastasis to the bone are prostate cancer and breast cancer. This next one is an example of Torsade de points or Torsade de points. I'm not really entirely sure. You probably won't get an actual EKG on the exam. I don't remember ever seeing one. But what this stands for is twisting of the points. That's what Torsade de points mean, twisting of the points. And if you can kind of imagine this kind of oscillating, almost twisting effect, you can see it really well right here and then really well right here. The amplitude gets really big, and then it gets really small, and then it gets really big again. And this is caused by a long QT interval. So the EKG itself might not be very high yield, but what is high yield is this drug-induced long QT. And they have a little mnemonic for this. So you need to know all of the medications that can cause this long QT that can precipitate Torsade de points. And the mnemonic they use is A, B, C, D, E, nice and simple. So the medications that cause long QT, A, B, C, D, E, the A is for antiarrhythmics, the B is for antibiotics, particularly the macrolides, the C is for antipsychotics, antipsychotics, if you will, notably haloperidol. The D is for antidepressants, mostly your TCAs. And then the E is for antiemetics, the most common one being ondansetron or Zofran that we use. So definitely medications to be aware of when you're using. You don't want to precipitate this long QT and Torsade de points. This next one is an example of hypertrophic cardiomyopathy. So I think in the past I showed a histology slide that showed hypertrophic cardiomyopathy. Now we're just looking at a cross-section of the heart. And really the most important thing to note here, there's definitely some thickening of the left ventricle. This is left and this is right. Definitely a good bit of thickening of the left ventricle. But the most important thing to note is this marked hypertrophy of the septum. And the important thing to remember with hypertrophic cardiomyopathy remember that classic vignette. It's going to be a young, otherwise healthy kid, probably doing some exercise, and they start having chest pain, or they just kind of collapse. Maybe they have a family history of sudden cardiac death, but if you get a vignette like that, hypertrophic cardiomyopathy should be very high on your differential. This next one is an example of a Pheochromocytoma. So maybe a little bit harder to identify as the picture itself because you aren't even really entirely sure what you're looking at, but this is the Pheochromocytoma, the mass here. And basically what this is it's a tumor of the adrenal medulla, so that's why it's in the middle as opposed to the cortex. Tumor of the adrenal medulla, and it arises from chromaffin cells. And the important thing to know about chromaffin cells is that they are neural crest cells, so just keep that in mind. The other important thing that I want to mention about Pheochromocytoma is that the treatment is alpha blockade first and then beta blockade. And the reason for that is to avoid hypertensive crisis. Should be really easy to remember. A comes before B, alpha block before beta block for treatment of Pheochromocytoma. This next one is a kind of a gimme. It's an example of the carpal bones, but I did just want to review it to make sure that everyone kind of has these memorized, because they may show a picture or ask you questions, which we'll talk about. So there are a couple mnemonics that are out there, really starting from like the thumb side and then either going around to the pinky and then coming all the way back, or going thumb to pinky. So the one that I like to use was some lovers try positions that they can't handle. I believe that's what it was. Yeah. So some lovers try positions that they can't handle. So scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. And that's going thumb to pinky, and then you start back up here, thumb to pinky again. Other people, I know there was another mnemonic that used to be passed around in medical school. It was so long to pinky, here comes the thumb. So scaphoid, lunate, triquetrum, pisiform, hamate, capitate, trapezoid, trapezium. That one goes thumb to pinky and then pinky to thumb. Honestly, whichever mnemonic works, I just wanted to show you guys this picture. Make sure that you have this memorized. And then the two important things to know with this are that the scaphoid bone is the one that is most commonly fractured, that is tested all the time. But the lunate bone is the one that is most commonly dislocated. And a lot of people forget that, and it can be a pretty straightforward question on the exam. Really unfortunate thing to get wrong, so make sure you don't forget it. And the very last picture here is going to be an example of osteopetrosis. And, just looking at this x-ray, try not to overthink it. If you just look at it and you think to yourself, oh, this is like really saturated and bright, something's got to be wrong. Well, you're right. It's osteopetrosis. And what's happening is that there's a failure of normal bone resorption. And the reason for that is because there's defective osteoclasts. So the osteoclasts are typically supposed to resorb bone. If they're not working well, then they can't resorb it, and it gets sclerotic and thickened like this. So you have diffuse symmetric skeletal sclerosis, and you see the symmetric sclerosis here. Both the femurs, the pelvis, all sclerosed. And the issue with this is that the bone fills in the bone marrow space. So one of the common things that you can see with osteopetrosis is because you have less bone marrow, you end up having pancytopenia. So osteopetrosis, know this x-ray, and know that pancytopenia is a complication. And that is the end of this video. Guys, I hope this was as helpful as the previous ones. Thank you so much for watching. As always, if you have any comments, questions, suggestions for future videos, please do reach out. Like I said before, I hope to make a couple more of these in the next coming months. Again, thank you so much for watching, and take care and good luck studying.